I need that hat. Always coming up. You're 6'1", right?
Yes, ma'am. Feeling low?
Kinda, sorta. That's your heart rate, 61. Could I take your blood pressure on your left arm?
Yes, ma'am.
Can you take your arm out, please?
My heart rate was low. Low.
61. You're young. That's the same age as me. I could do, like 7 years old. You feeling alright? Are you an athlete?
Yeah,
Oh,
but I haven't been
but
in like 2 years.
but still, it's probably running low because of that. Most athletes have low heart rates. Good. 1970. Dr. Temple should be in the
Yes, ma'am.
Have a good holiday.
You too. God bless.
Thank you.
Okay. Need that? Thank you. Would you mind get the ring sign? Thanks. How you doing, man? What's going on? Cash only. Cash money. So what's going on in your world?
A lot of nothing.
A lot of nothing. You said a lot of nothing?
Yeah.
What's
Hey,
the matter?
now.
Don't ask me for pain medication.
Nah, see?
What's up?
That's what I was going to ask you.
Nah, man, you don't even want to ask me for that. We don't prescribe any of that stuff.
Now, look, I know that, right? So, Miss Brittany been trying to help me.
Yep.
And she sent me over there to 2701
Uh-huh.
to Dr.
Lincow.
Yeah. So, Dr. Lincoln.
No one's going to give it to you. I'm just telling you right now, you're wasting your time. There's doctors that do that and doctors that don't. No one's going to give you the medication I think you're asking for. You're looking for like painkillers. No one's going to do it.
All right.
Them days passed, man. The guys that do that, there's doctors that still do, but they're all in trouble.
All right. And you're right about that. And I understand that. But at the end of the day, now let's take the pain medicine away. How are we going to get myself checked out to see what's really wrong with me now?
Well, we're going to get some MRI scans for you. And MRI scans will tell you what's wrong.
All right.
Huh? Now, you did see Dr. Selgrath. Well, I'm telling you, you walk into the doctor's office and you tell him to look for pain medication, he's going to tell you not to come back.
I don't tell them that.
No, I know.
I don't ask them
I'm
that.
just letting you know where these cases are right now.
I hear you, sir. I don't come in there and ask them. All I do is this. Require, as far as my symptoms,
Right.
require the medication.
Right.
See?
But you were getting oxycodone even before this accident.
You're right.
What was that for?
And that's what I'm trying to find out now. Because I'm still hurt.
No, but why were you, who prescribed you oxycodone?
Dr. Gregory Nelson.
And what was he giving you oxycodone for?
Well, one of the problems is the cervical.
Is what? Cervical?
The cervical
The neck.
or the lumbar. He was giving me the pain medication for the lumbar.
Okay, so you were having on pain medication even before this. You were taking oxycodone before this accident.
Yes, sir. I haven't had it in a year.
No, you had it in April.
Well, yeah, I did.
Don't be bullshitting me, man.
No. I haven't been BSing you. So
I can tell. Reason I can tell, I can log into the state website.
No. Listen, I know you can. I know everybody can. And when you logged in there, you seen April was only 12, and they was 5s. See? So you know I'm not like. But the one you just logged in was 15 milligrams Percocets. Because something is wrong with me, doc.
Hang on one second. Yeah, there's something wrong with you even before you fell.
No, I understand that.
Hang on, let me just double check. Hold on. But you're also getting two different muscle relaxants at the same time.
When?
Going back to April. Metaxalone and cyclobenzaprine. Right? So that's the problem, man. So here's what we have to agree to do. We're going to help you with this case for Mr. Simon, right? We're going to keep pain medication out of it. If you want to get involved in pain medication and asking for pain prescriptions, I'm going to have to ask you to go someplace else. I want to help you. You're a great guy, but I can't do it. If it's always about getting pain medication, I can't do it.
Right.
Here's why. First of all, your case is in jeopardy anyway because there's all these opiates all over the place, so even before this happened. It's going to look like you're seeking pills, like you're drug seeking. And then you got no case anyway. So why are you bothering?
Okay, so now let me share this with you. I do have a case.
I think you do, but the problem is there's opiates on your record even
Okay.
before this happened.
And
Let me
yes-
finish.
All
I've
right.
got a lot of experience in doing this. I've testified hundreds of times on behalf of my patients. And one of the things they look at as bad marks on these cases is the ongoing use of opiate medications, which you were on before this happened.
And yes, I would testify and say I was on them,
Right.
right? So since I was on them, I haven't been on them since that, and I have a new accident August. I haven't been on them April. So you tell me, I don't know where I'm still hurt then when you do your CAT scans or whatever. So I'm not chasing pain medicine. All I want for Christmas is to get checked out and y'all doctors stop playing with my life. You see? And now since you done seen April, you done seen all the hospitals I've been to.
Right.
And what I was sharing with you, I had 2 car accidents. You know what? Let me just bring it down. It's not you. It was the other doctor. What's his name? Gonzalez?
Here,
Yes.
Dr. Gruthen.
Yes, I seen him first. And that's what I shared with Dr. Gruzen. So let me just read you an update with you. I was in 2 bad car accidents. March 22nd, 2019. And then,
I'm writing it down.
okay.
Good. 3/22/19,
So March 22nd.
2019.
Yes, sir. 1 car accident, okay? 4 months later, July 22nd, 2019, another car accident. And I had spleen laceration in that second car accident. Yes, my right groin surgery due to spleen surgery.
And who was the doctor who treated you with that?
Okay, that was Temple Hospital, July 22nd,
And
2019.
how about the March one?
The March one,
Yeah.
I went to the hospital. I would say Temple. It was like a quick in and out or whatever. And I'm telling you the truth. And I went to therapy. So when I went to
Where'd you get the therapy?
okay, Dr. Gregory Nelson, still in Washington Lane, Nelson Pain Management. So I went up there in March.
Alright.
My lawyer is Scott Gallant to this day.
I know Scott.
Thank you. My arbitration is next month.
How come Scott isn't representing you for this case?
Now this is the thing. He's represented me on a case already. The arbitration is January.
Right.
So this is the thing. In March, I got hurt. I went and found Mr. Scott, and I went and found Mr. Nelson. And I don't know if they, go hand in hand, but I found the doctor and I found the lawyer, basically.
Right.
Okay? July accident happened. I got hurt. I stayed home for about a week or 2, because that July hurted me. I had surgery.
On what?
My spleen.
Okay, hang on one second. Share dictation box. He presents the office for evaluation of injuries sustained on August 26, 2021, period. He acknowledges he does have a past history of injuries sustained to his cervical spines and his lumbar spine, period. He suffered spinal injuries on March 22nd, 2019, period. He received therapy for this, period. He then suffered injuries in another motor vehicle accident on July 22nd, 2019. Go ahead, what are you telling me?
You're right. I got in an accident in March. Nobody never really checked me out. So there wasn't no diagnosis really. This is a shoulder or whatever, my foot.
Where'd you go for that?
Dr. Nelson.
Okay, so you thought, okay.
So now this
Hang on a sec. He saw Dr. Gregory Nelson, period. Period, he also saw Dr. Gregory Nelson again, period. All right, you saw him for both these accidents.
No, I seen it for one. That's what I'm sharing with you.
Which one did
I
you
had-
see him for?
For March, the first
Okay,
one.
who'd you see in the second one?
Nobody. But this what happened. You ready now?
I'm ready.
Thank you. You're the only one in this world. So Dr. Nelson was treating me for March.
Right.
March was really nothing, you know? A little bumps and bruises, but nothing, but I could get treatment, basically.
But July 2nd was worse.
Thank you. So
Yeah.
what happened was me going to therapy for March until July, okay. When July happened the same day, they took me to Temple. I stayed in, the ICU for 2 days.
Okay.
I left the ICU,
Okay.
okay?
And
So
what's that?
after I left this ICU in 2 days, I went home for 2 days. The pain medicine they were giving me from the ICU, it wore off. So I came back 2 days later to Episcopal. Episcopal did whatever they did. I went and got an opinion. I went to Einstein.
And you said, okay, he was evaluated at Temple Hospital, and he was also evaluated at Episcopal Hospital, and he also received care at Einstein Medical Center, period. And that's when you lacerated your spleen in, right?
Thank you. In July. So Temple did the surgery in July.
He suffered a splenic laceration, period. He had splenic surgery in July 2019, period.
So,
True that?
yes, sir. You on the road. So now, here go the twist. There's no lie. Because I left the ICU in 2 days, I was hurting. I said, wow, I was getting treatment for March accident. Why are you still home? I said, okay. So when I did, I'm talking about after the hospital, when I went back. I'm talking about when I was home after the hospital.
Right.
So I noticed I was still hurting. You know, I was getting treatment. When I go back, Dr. Nelson's staff say, I can't come. I say, why? They said, because you got hurt in another car accident. Ain't you pursuing it? I said, no.
No.
So they say, so I already learned the ropes. If I'm gonna pursue it, I have to stop the first one and then let my lawyer know, and then we continue the second one. But that's the thing. They knew that, and I didn't, right?
Right.
So I stayed home for like 2 weeks, and then I came back. And I seen the man himself, Dr. Nelson. I said, Mr. Nelson, Mr. Austin said that I was terminated. He said, no, ain't you pursuing another case? I said, no. He said, so you want to continue therapy? I said, yes. Now, here we go. So around like the end of July 22nd, we can say about around August, I'm just picking, August 3rd, 4th, 5th, I continue my therapy. And then from August 17th, that's when we had the first appointment.
I'm listening.
And,
When's the last time you had received any therapy from Dr. Nelson?
October the 28th, 2020, at the last time.
He states the last time he received any therapy from Dr. Nelson was October 2020, period.
28th. October 28th, 2020.
28th, 2020, period. After that, he still had 28th, 2020, period. He was then left with some neck pain and some low back pain, but his symptoms for his neck and low back were worsened on August 26, 2021, period. He had occasional neck pain, 2-3/10, period. He also had occasional low back pain, 2-3/10, period. His pain is more severe subsequent to the fall on August 26, 2021, period. New paragraph. He still has cervical and trapezius spasm, period. The trapezius spasm is present bilaterally, period. He has thoracic spasm as well, period. The spasm includes the rhomboids, coming with the trapezius muscle groups and the levator scapula, period. Now, here's when we're ready to help you, my friend. And I'm saying my friend with all sincerity.
And one more thing, and I will finish. You got everything down pat. So this is the thing. You sent me to 13th and Wagner to Dr. Holden. I go there. She did the things in my legs, like the acupuncture. It would hurt my back or something. And I was like, and I felt the pain in my leg. I said, what's wrong? She said, you got 5 damaged nerves. She got
Michelle.
5 golden discs.
That's
Michelle
right.
Y. Holden.
Michelle, I know her.
Yes, ma'am. I mean, yes, sir. So
He also had MRI scans, period. He had EMG tests performed with Dr. Michelle Holding, period. Cap that. He states, quote, she told me I had 5 damaged nerves, quote, period. Damaged. He still has lumbar paraspinal spasm, period. He has flattening of the lumbar lordosis, period. New paragraph. He will get cervical and lumbar MRI scans, period. We will try to get the records regarding the prior injuries he sustained on both March 22nd, 2019 and July 22nd, 2019, period. Consideration will be given to a pain management consultation period. We'll reassess in 4-5 weeks period. Dictated in the presence of a patient to ensure accuracy period. Transfer text. Alright, so here's what we're gonna do.
So this what he did.
Is everything there accurate,
So
right?
this, yes sir, so this what he did.
Huh.
I you know, cause I had, that what I shared with you? The
Uh-huh.
saturation of spleen, right, and I had the surgery.
Right.
Right. So he took my incidents off that July incident.
The patient,
No, the doctor. He
Yeah,
took the 2 parts off the July, the top and the bottom, and he put them on March. And the only reason why I can say that, because I had surgery with that spleen in that second car
I
accident.
got you.
And then I told you I stayed home and I came back. See, Miss Veronica, his assistant, she kept giving me MRIs for 2 years. I got 2 bullets, so I need CAT scans. And when she gave me the CAT scan, after, you know, I came back and all that, right. The CAT scan, he sent me to Einstein first. And when he sent me to Einstein, Einstein sent a letter to my house. So I read the letter as best as I can. I seen L3/ and L5C, you know. So what I did, I called Einstein, and Einstein said they couldn't give me information. Go to my provider. I went to Dr. Nelson. He sent me Ms. N.Y. Hogan. That's when I found out about the EMG lower. I had an appointment for the EMG upper. This is the last thing. The EMG upper, September the 30th. September the 30th, 2020. I had an appointment for the EMG upper due to Corona. It got canceled October 14th. And Miss L.Y. Holton, she not only had 13th from Wagner, she was down 15th for Locust. They sent me down there for my EMG upper. Nobody never checked it. So whenever Mr. McNeil got hurt and went to the hospital, they told me I had some stuff wrong, and I still don't know, Doc. So you can put the medicine to the side, because now you already know I'm hurt.
I got you. So here's you have bullet fragments, so you can't get MRI scans, correct?
Yes, sir.
Okay. With regard to any diagnostic testing coming, he cannot get MRI scans, period. He has retained bullet fragments from a gunshot wound that occurred, when was that gunshot wound?
195 and 2003. 2003 the left arm.
In 1995 and also in 2003, period.
And the one in the back, that's from 95. So, yeah, that's what happened.
Rough neighborhood, huh?
Yeah.
Where'd you go up?
North Philly, 32nd and Diamond.
Yeah, a friend of mine, just saw him today, he grew up around there.
Yeah.
Yeah, he just got arrested for DWB.
What's that? Drywall Black?
He's we're very close friends. He and I are born the same exact day, same year. We call ourselves twins. Obviously, we're not, right? He's a black eye on
Yes,
loud.
sir.
But when he got pulled over for DWB, and I was going to go to court to testify for him.
Oh, yeah. So the good news is, I love Miss Brittany. You have a good lady. She got hospitality. She's been really helping me.
Yeah.
I went over there to next to what's that, Nazareth, across from him.
I saw the report.
I went there to go see Mr. Seinfeld, but I seen another doctor.
Dr. Selgrath.
Yeah, the knee replacement man.
Yeah.
So what happened was I shared with everybody and caught up. So this is the thing, and I'm done.
That's not the thing. This is the John.
Hi, thank you. Doctor, what's his name again?
Selgrath.
Mr.
Linkow.
Mr. Linkow. He sent me up there to Red Lion Road, IMPC.
Okay, PMC.
Yeah, I went up there, they went through the authorization. So then when I was coming back, and I went back to Mr. Lucas, they gave me the authorization. To make it short, I get it tomorrow, the authorization.
The CAT scan?
Yeah, for the EMG upper. So to save you that trouble,
EMG or CAT scan?
they said the I'm sorry.
I think you mean a CAT scan.
Yeah, CAT scan for the cervical.
Okay, so you did see Dr. Linkow. Okay.
Yeah, so we made it out. I go there tomorrow at 9:15 for the that's just for the first one. Not
Don't say the first one, it's a John.
The John. Yeah, we go up there to get the
That's
she
right.
said, and she taught me though, lumbar, bottom, and cervical, spine, and neck.
That's true.
And let me share one more thing with you. I gotta be truthful with you. I had to slip and fall in Nazareth. So that's when you seen the medicine in April,
Yeah.
because it kicked in.
When
And
was the slip and fall? The one that you're here with today?
no,
You had another.
that was July. That was like June 7th.
You suffered an injuries in a slip and fall in July.
Yeah, so
Before this one.
so that's how I got the boot.
Okay.
So I see the doctor tomorrow for the boot.
Okay.
He told me this. That's why the boot not on. He told me do what I could do without the boot. So
Okay.
that's why, you know.
So interesting. He also suffered injuries in a slip and fall
Yeah.
at Nazareth Hospital. And what did you injure in that one?
Now that was the thing. Now it was the ankle and my right knee,
Okay.
right? So
When was that? You said July what?
yeah, no, June 5th.
On June 5th, 2021, period, he injured his right ankle and his right knee, period.
Now I went to Chestnut Hospital for it and Nazareth, you know, for both. And cause one, they, you know, every time I tell them both, they only do one. So I went and they diagnosed the ankle and they diagnosed the knee, but they don't do nothing for the knee. So in the process of that, probably about July, I went to Trinity Hospital. You know why? Cause from the fall and all this stuff, guess what happened to me? No medicine. I had torticollis.
Torticollis,
Yeah, that kicked in. And it had me like this. And then my neck was like, I felt like a bull, man.
So you already have the CAT scan scheduled?
Yeah,
right?
for tomorrow at 9, Doc. See how I'm working with you?
I appreciate
I haven't been bothering you by no medicine now.
Hang on 1 second.
And I'm still not.
He did see Dr. Linkow,
Yeah.
and Dr. Linkow ordered CT scans, which are to be performed at IPMC.
9:15. It's at 9:30. It told me to be there 9:15. So I thank you and Ms. Brittany for that.
Tomorrow, period?
Yep, tomorrow.
Scratch that.
Yep.
Tomorrow, period? Dictated in the presence of the patient to ensure accuracy, period? Alright. So here's what you do.
You're the only one. Look. You got all this done. And that's what happened to me.
I
You
did
know what
it
I'm
so
saying?
I did it right in front of you so you know what's in the report.
So I ain't lying to you. So
I appreciate that, man. I appreciate that.
nobody don't want to check me out or nothing. I fell at the manhole the same day I got assaulted. Punched in the face, no lie. The ambulance seen me that day. He the same one seen me later on that night.
And when did you get
Took me
punched?
to Temple and I tried to put me in a 302 chair.
When did you get punched in the face?
Alright. These are the last ones, okay? August 26th, I got punched in the face. That's the day I fell in the manhole. So I told everybody, they don't believe it though.
So someone punched you in the face and then you fell in the manhole?
No, I got punched in the face earlier that day.
Okay.
Later on that night, going to the hospital, fell in the manhole. And the ambulance guy, he left me 2 times.
One sec. He also suffered an assault on August 26, 2021, coming earlier in the day when he fell in the manhole, period. He was punched in the face, period. Same day he fell in the manhole, period. Manhole.
The day I fell in the manhole. That's the story. They got the video, and that's the ambulance. Now you don't see me there because they took me out.
Oh, you're already gone.
Yeah, I'm in the car. See, the store had the video. The cops took the video. I told my lawyer. So I made this for my lawyer to show her that, watch. My phone not on, so I only can show you the little pictures I did take. If it was on, I could show you the real stuff. So, but you got it though.
I got you.
So that day I got assaulted. Later on, I fell in the manhole. Look, here we go. See? Told you. Not lying. And then I'll leave you alone. Look, that's the 26th. I'm in the manhole. Watch this. See, they covered the manhole. I had came back that day after I fell in the hospital, called the cops. And you see that? That's the cops. The cops in the, there I go, see?
Yeah.
And you see Mr. Cheeky right there? And now you see me right there to see the trash can. So if I come back, come on, you know how this stuff be. So if I come back, see? Same spot. And that's the story with the video.
Follow me, man. Let's get you hooked up.
Yeah.
So you'll hook up with Linkow.
Yep. Tomorrow to that CAT scan, and then we just go from there. Yeah, I ain't come to bug you for no medicine,
I
Doc.
appreciate that.
I just
You
really
guys
just
trying to help you out, but I just
look. You see right here?
Yeah.
It tightens.
Right.
And sometimes if you know, I stay like in one position,
Yeah.
and I might just go for. Oh, I can be laying down, and when I come up and I feel it tight, so therapy taught me. Just do what you can, don't push. So I learned different techniques to make it short. Don't dog me.
Now you're using the right words.
And sometimes the pain that comes from here, it shoots to my brain. No lie.
Follow me, come on.
All right.